Hello everyone and welcome to our channel English Online. We are so happy to have you here with us today. In this series, we're going to focus on something really important: visiting the doctor. Going to the doctor can be a stressful experience for many people, especially when you're in a foreign country and English isn't your first language. But don't worry. We're here to help you learn the right words and phrases so you can feel confident and comfortable when talking to a doctor. Before we get started, if you want to improve your English every day and be part of our friendly learning community, don't forget to like this video, subscribe to our channel, and share it with your friends who are also learning English. We're here to support you step by step with fun and easy lessons. So, if you're ready to improve your English, let's dive into today's lesson and start learning about how to visit the doctor and communicate in English. Episode 1. Getting ready for the doctor's visit. When you decide to visit the doctor, the first step is making an appointment. In many places, you can make an appointment by calling the doctor's office. You might say, "Hello, I'd like to make an appointment with Dr. Smith." The receptionist will ask for some details, like your name and reason for the visit. If you don't know when to go, they will offer you the next available time. For example, we have an opening on Wednesday at 3 p.m. Does that work for you? If you can't make that time, you can suggest a different day. "I'm free on Thursday. Can I come then?" Once your appointment is set, it's time to prepare for the visit. The first thing you should do is make a list of any symptoms you are experiencing. This will help you explain everything clearly to the doctor. For example, if you have a headache, you can say, "I have a bad headache that started yesterday." If you have a sore throat, you might say, "My throat hurts when I swallow." Writing down your symptoms helps you remember everything when you're at the doctor's office. You should also write down any medications you are currently taking. This is important because some medicines might interact with others. When you're at the doctor's office, they will ask about your medical history. So, it's good to know if you have any allergies or previous health issues. For example, you might say, "I'm allergic to penicillin," or "I have high blood pressure." On the day of your appointment, try to arrive a little early. This gives you time to fill out any forms and relax before seeing the doctor. When you get to the doctor's office, check in at the reception desk. They will ask for your name and possibly your insurance information. If you don't have insurance, don't worry. You can still receive care. Make sure to bring your ID and any paperwork the doctor's office needs. While you wait for your turn, try to stay calm. It's normal to feel nervous, but remember, the doctor is there to help you. When it's your turn, the nurse will call your name and take you to the exam room. They may ask you to step on the scale to check your weight. They will also take your blood pressure, temperature, and sometimes your heart rate. Once all of that is done, the doctor will come in and start talking to you. The doctor might begin by asking questions like, "What brings you in today?" You can respond with something like, "I've been feeling sick for the past few days." Or, "I've had this pain in my stomach for a week." It's important to be honest and clear with the doctor about your symptoms. The more information you give them, the better they can help you. After listening to you, the doctor might examine you. They may listen to your heart and lungs with a stethoscope. If needed, they might ask for tests or a blood sample to find out more. Sometimes they will prescribe medication to help you feel better. For example, "I'm prescribing some medicine for your pain. Take it twice a day." Before leaving, make sure to ask any questions you might have. For example, "How long should I take this medicine? Or, when will I start feeling better? If you don't understand something, don't hesitate to ask again. You can say, "Could you explain that again?" Or, "I'm not sure I understand." Once the appointment is over, the receptionist will ask you to pay for the visit. If you have insurance, they might process the payment for you. If you need a follow-up appointment, don't forget to schedule it before you leave. The doctor's office will also give you a prescription if needed. You can take it to the pharmacy to get your medicine. Finally, after your visit, it's important to take care of yourself. Follow the doctor's instructions carefully. Take any prescribed medicine, drink plenty of water, and rest. If you feel worse or have more questions, don't hesitate to call the doctor's office again. It's always better to ask if you're unsure about something. Now that you know what to expect when visiting the doctor, it's time for the next episode, where we will talk about how to explain your symptoms and ask for help in more detail. Stay tuned for episode 2, and we'll continue practicing together. Episode 2: Explaining your symptoms. When you visit the doctor, one of the most important things is explaining your symptoms clearly. In this episode, we will focus on how to describe what you're feeling so the doctor can give you the best care. Knowing the right words to express how you feel can make a big difference in understanding your condition and getting the proper treatment. When you first speak with the doctor, they will likely ask you, "So, what seems to be the problem today?" This is a general way of asking what's wrong. You can answer by describing what you are feeling. For example, "I've had a headache for the last 2 days." Or, "I've been coughing a lot and feeling tired." Be sure to mention how long you've had these symptoms. This helps the doctor know if it's something recent or a longer-term issue. In addition to describing the symptoms, it's important to explain their severity. For example, if you have pain, you can say, "The pain is sharp," or "It's a dull ache." If it's something like a headache, you might say, "It feels like pressure in my head," or "It's throbbing and it's worse in the morning." If your symptoms are more serious, you should let the doctor know. For example, "I feel really weak and can't get out of bed," or "I'm having trouble breathing." Another helpful way to explain your symptoms is by saying what makes them better or worse. For example, "The pain gets worse when I move my arm," or "I feel better when I rest." This gives the doctor more information to understand your condition. If you are feeling feverish, you might say, "I feel really hot and I have chills," or "I've been sweating a lot at night." In some cases, the doctor may need to know if you've had any recent injuries. For example, "I hurt my back while lifting something heavy," or "I twisted my ankle while walking." If you're not sure how to describe your symptoms, don't worry. Use simple language and focus on what feels most important. For example, you could say, "I don't feel well," or "I think something is wrong with my stomach." The doctor will help guide you if you're unsure. In addition to physical symptoms, mental health is just as important. If you're feeling anxious or depressed, be sure to mention it. You might say, "I've been feeling really down lately," or "I've been very anxious for the past few weeks." Mental health is important, and it's good to talk about it with your doctor if it's affecting your daily life. Finally, if you have any questions or concerns, don't be afraid to ask. You can say, "Is this something I should be worried about?" Or, "Can this be treated easily?" Doctors are there to help, and it's okay to ask for more information if you need it. Once the doctor has all the information, they may need to run some tests or give you a diagnosis. They might say, "We'll need to do some tests to figure out what's going on," or, "I think you have a viral infection, but I'll give you some medication to help with the symptoms." It's important to listen carefully and ask questions if anything is unclear. Stay tuned for episode 3, where we will talk about follow-up appointments, how to handle prescriptions, and how to talk to the pharmacy. Episode 3, Follow-up appointments and prescriptions. After your initial visit to the doctor, sometimes you might need a follow-up appointment. Follow-up appointments are important because they allow the doctor to check how you're doing after your treatment or to see if your symptoms have changed. In this episode, we'll talk about how to schedule a follow-up appointment, what to expect, and how to handle your prescriptions. If your doctor wants to see you again, they will often tell you when to come back. For example, "I'd like to see you in 2 weeks to check how you're doing," or "Come back in a month for another checkup." You will then need to contact the doctor's office to schedule the next appointment. You might say, "Hello, I'd like to schedule my follow-up appointment for next month." If the doctor gave you a specific date, you can just confirm it. "Yes, I'm available on the 15th of May. Sometimes the doctor will give you instructions to follow before your next appointment. For example, "Make sure to rest for the next few days and take the medication as directed." It's important to follow the doctor's advice carefully to recover faster. At your follow-up visit, the doctor will check if your symptoms have improved. They may ask questions like, "Has the pain gone away?" Or, "Are you feeling better since the last time we met?" If your symptoms haven't improved, don't be afraid to tell the doctor. It's important to be honest so they can adjust your treatment plan if necessary. After your doctor's visit, you might be given a prescription. A prescription is a document that tells the pharmacy what medicine you need. When you go to the pharmacy, the pharmacist will read the prescription and give you the medicine. If you don't understand how to take the medicine, you can ask the pharmacist. For example, "How many times a day should I take this?" Or, "Do I need to take this with food?" When you get your medication, make sure to check the label carefully. It will have important information like the dosage and any side effects. It's always a good idea to ask your doctor or pharmacist if you're unsure about anything. If you have any allergies or are taking other medications, let them know. Sometimes the doctor might prescribe medication for a short time, like antibiotics for an infection. Other times you may need to take medication for a longer period, such as medicine for high blood pressure. Make sure to take the full course of any medication, even if you start feeling better. If you stop taking the medicine too early, your symptoms might come back. In addition to medications, some doctors may suggest lifestyle changes. For example, "You should eat more fruits and vegetables to improve your health." Or, "Try to exercise regularly to help with your back pain." These recommendations are just as important as the medication you take. It's important to follow them for the best results. If you have any issues with your medication, like side effects, don't hesitate to contact your doctor. For example, if you feel dizzy or nauseous after taking the medicine, you should tell your doctor right away. They may change your prescription or suggest something else to help you feel better. If you are given a referral for a specialist, such as a cardiologist or an orthopedist, the doctor will explain why you need to see them. You will then need to make an appointment with the specialist and provide them with your medical history. For example, "The doctor referred me to see a cardiologist for my heart condition." Specialists are experts in specific areas of medicine, so they can give you more focused care. In episode 4, we'll talk about how to communicate during a medical emergency and what to do if you need immediate care. Stay tuned. Episode 4: Communicating during a medical emergency. In this episode, we're going to focus on what to do if you have a medical emergency and need immediate help. Emergencies can happen at any time, and it's important to know how to communicate effectively, especially if you're in a foreign country and English is not your first language. We'll discuss the steps to take, how to explain your situation, and how to ask for help when you need it most. The first thing you need to know in an emergency situation is how to call for help. In most English-speaking countries, the emergency number is 911 in the USA and Canada. When you call, the operator will ask you several questions to determine what kind of help you need. You might say, "Hello, I need an ambulance right away. My friend has passed out." Or, "I've been in an accident and I can't move my leg." The operator will ask for your location, so make sure you can give them your exact address or a nearby landmark. For example, "I'm at 123 Main Street in front of the supermarket." Or, "I'm near the corner of Oak Street and Maple Avenue." If you don't know the exact address, describe your surroundings as best as you can. While waiting for help to arrive, it's important to stay calm. If someone is with you, ask them to stay on the phone with the operator and follow any instructions they give. For example, the operator may tell you, "Check if the person is breathing. If not, start CPR." Or, "Keep the injured person still and don't let them move." When medical professionals arrive, they will assess the situation quickly and may ask you for more details. Be sure to tell them exactly what happened. For example, "My friend fell off a ladder and hit their head," or "I slipped on the ice and hurt my back." The more information you provide, the faster they can give the right treatment. If you need to go to the hospital, the medical team will take you by ambulance. You will likely be asked to fill out some forms once you arrive at the hospital. It's helpful to know how to explain your medical history, especially if you have allergies or chronic conditions. For example, you might say, "I'm allergic to peanuts," or "I have asthma and carry an inhaler." This helps the doctors treat you more effectively. In the emergency room, the doctors will prioritize your care based on the severity of your condition. For example, if you have a serious injury or are having difficulty breathing, you'll be treated first. Less urgent cases might need to wait for a while. While you're waiting, you may be asked about your symptoms. You might say, "I feel dizzy and my heart is racing," or "My arm is swollen and painful." If you have trouble explaining what's wrong, try to focus on the most important details. For example, "I'm in a lot of pain," or "I can't breathe properly." The medical staff will understand that you're in an emergency situation and will do their best to help you. If you don't speak English very well and are worried about communication, don't hesitate to ask for an interpreter. Many hospitals and emergency services provide interpreters to assist patients who don't speak English. You can simply ask, "Do you have someone who can translate for me?" If an interpreter is not available, try to use simple words or gestures to explain what's wrong. In some emergency situations, you might be required to sign a consent form before receiving treatment. The doctor or nurse will explain the procedure, and you can ask questions if you're unsure. For example, "What exactly will you be doing?" Or, "Is this the only treatment option?" Once you have received treatment or been stabilized, the doctor will explain your care plan. You might be given instructions on how to take care of yourself at home or what medications to take. For example, You should rest for the next 24 hours and take these painkillers every 4 hours. Or, you need to follow up with a specialist in a few days. Emergencies can be stressful, but with clear communication, you can get the help you need. Remember, if you're ever in doubt, don't hesitate to call for help or ask questions. Your health is the most important thing, and it's always better to seek help early rather than wait too long. Stay tuned for episode 5, where we will focus on the recovery process after a medical emergency and how to manage your health going forward. Episode 5, Recovery and Managing Your Health. Now that we've talked about how to visit the doctor, explain your symptoms, and handle an emergency, it's time to focus on the recovery process and how to manage your health going forward. Recovery can take time, but with the right care and the right mindset, you can feel better and stay healthy. In this episode, we'll discuss how to follow the doctor's advice, maintain your health after treatment, and prevent future health problems. First of all, it's important to follow your doctor's instructions carefully during recovery. If the doctor gave you a prescription, be sure to take the medicine exactly as directed. Don't skip doses, and if you have any questions about how to take your medication, don't hesitate to ask your doctor or pharmacist. For example, you might ask, "Should I take this medicine with food?" Or, "How long will I need to take this medication?" Besides taking medication, your doctor may suggest some lifestyle changes to help you recover faster. For example, if you've had surgery, you might need to rest for a few weeks and avoid heavy lifting. If you have a chronic illness, you may need to adjust your diet, exercise more, or reduce stress. Following these recommendations will help you feel better sooner and keep you healthier in the long run. If you feel like your recovery isn't going as planned, be sure to contact your doctor. For example, if you're still in pain or if your symptoms return, don't wait too long to reach out. You can say, "I'm still feeling a lot of pain. Should I come back for a checkup?" Or, "My symptoms seem to have returned. What should I do?" After the initial treatment, the doctor may suggest follow-up appointments to check on your progress. These visits are important because they allow the doctor to see how well you're recovering and whether any adjustments are needed. At these appointments, the doctor may ask questions like, "Have you been following the treatment plan?" Or, "Are you feeling any better?" If you have any new symptoms or concerns, this is the time to mention them. During recovery, it's also important to pay attention to your mental health. If you're feeling stressed or anxious about your condition, let your doctor know. For example, "I've been feeling really anxious about my health lately," or "I'm worried that I might get sick again." Mental health is just as important as physical health, and the doctor may offer support or suggest ways to cope with your feelings. While you're recovering, try to stay active in ways that are appropriate for your condition. For example, if you're recovering from surgery, your doctor may recommend light exercises or walking. Staying active can help prevent complications like muscle weakness or joint stiffness. If you're unsure about what kind of activity is safe, ask your doctor for advice. You may also want to focus on eating a healthy, balanced diet during recovery. Eating foods rich in vitamins, minerals, and protein can help your body heal faster. For example, fruits, vegetables, whole grains, and lean meats are all great choices. Drinking plenty of water and getting enough sleep will also help you recover more quickly. Lastly, it's important to take care of your long-term health after recovery. The doctor may suggest preventive care, like getting regular checkups, screenings, or vaccinations. For example, You should have a checkup every 6 months to monitor your health. Or, it's a good idea to get the flu vaccine each year. By taking preventive steps, you can catch any potential health problems early and stay healthier in the future. That brings us to the end of our series on visiting the doctor. We've covered everything from describing symptoms to handling medical emergencies and managing your recovery. Remember, taking care of your health is a lifelong journey, and it's important to stay informed and follow your doctor's advice. If you ever feel unsure or need more information, don't hesitate to reach out to your healthcare provider. Staying proactive and taking care of your health will help you live a long, healthy life. I hope you've enjoyed this series, and if you want to learn more about how to manage your health and communicate effectively in medical situations, make sure to check out our other videos. Thank you so much for being part of the English Online family. We hope this video helped you improve your English while learning important health vocabulary. If you enjoyed this video, don't forget to like, comment, and subscribe. And if you want to learn more every day, make sure to join us again. Take care, stay healthy, and I'll see you in our next lesson. Haha.